I'm Breon Stokes. Welcome everyone to this new and stimulating training we have provided for you. As an employee of the Herbal Creamery, this training is required for everyone and will help you understand edible consumption. I know most of you have consumed edibles before. Some have had great experiences and some not so much. It's okay if you don't know much about edibles. This training will provide an overview of what to expect not only when you consume edibles, but when you are serving customers who visit the Herbal Creamery. Please feel free to refer to this training when you need a refresher or when you would like to review certain modules. This training will be about an hour with 4 modules that will cover the material. After each module, there will be a small 3-question quiz you will follow up on to help reinforce the material. So let's get started. The Herbal Creamery also provides its guests with substantial information on cannabis from respected journals and reliable media outlets. While members can utilize this space to consume infused cannabis products, the goal is to inform and educate on the latest trends and practices within the cannabis industry. Traditionally called edibles, they come in multiple forms, including candies, cakes, cookies, brownies, and desserts, drinks, pills, oils, spreads, and dips. Some companies also offer cooking services that infuse cannabis within your prepared meal. Many users, especially individuals aged 30 and under, have opted for infused products. These training materials will be vital in transferring knowledge to employees to empower them to help identify specific therapeutic and adverse effects that guests might be experiencing while at the Herbal Creamery. Let's look at the objectives. So here are the terminal objectives. State laws for consuming cannabis. After viewing this course, trainees should be able to explain the legal regulations surrounding the consumption of cannabis edibles in the state. Customer education and communication. After viewing this course, the trainees should have the knowledge and skills to educate customers about safe edible consumption practices. And last, we have health and human consumption. After viewing this course, trainees should understand the effects of the pharmacology of cannabis edibles. Enabling objectives. We have quite a few, so I'll sum them all for you. Dosage and potency awareness. Trainees will be able to explain the endocannabinoid system, difference between THC and CBD, understand the effects of cannabis on the body and drug interaction with human consumption, general dosing guidelines. We'll also recognize different types of edibles, health and safety risk, which include drug interaction, risk of overconsumption, and delayed onset. And we'll also discuss how to obtain medical cannabis certification in your state. Medical cannabis is a Schedule I substance under the Controlled Substance Act. Federal law prohibits the use of cannabis THC. However, medical cannabis is legal in many states within the U.S. and other parts of the world. Federal law prohibits the use of cannabis in contrast to the hemp plant, which produces CBD. CBD contains less than 0.3% of THC. THC is allowed to be used for medical reasons in most states. You might qualify for treatment with medical cannabis within your state if you meet certain requirements. Below are certain qualifying conditions: Alzheimer's, AIDS, HIV, glaucoma, epilepsy, seizures, and the list goes on and on. These vary by state. Module 4 will get into more detail about obtaining your cannabis card.
The endocannabinoid system, also called ECS, are naturally occurring chemical compounds in the human body. They are vital in helping regulate multiple body functions. Endocannabinoids bind to cannabinoid receptors like CB1 receptor, which can manipulate central nervous system functions like mood and pain management. These compounds are essential in maintaining a balanced homeostasis environment internally. They also have potent medical and therapeutic properties for the body. So what is homeostasis? Homeostasis is defined as when a living organism can sustain internal stability while modifying to changing external conditions. This is done by dynamic self-regulating process that can adjust internal conditions as needed to survive outside or external changes. Many factors can affect homeostasis. The most common are genetics, physical condition, diet and nutrition, psychological health, and side effects of medicines and medical procedures. Can you think of an example of homeostasis? How about when your body temperature is regulated, when it sweats or it cools off? The body also retains heat. Blood pressure is an example, and the amount of water in your body. Can you think of any more?
So as you can see, there's a picture which kind of depicts the endocannabinoid system. You have your CB1 receptors and your CB2 receptors, and we'll get into more detail with those. But you can see how they're all throughout the body. Research is still being developed to understand the ECS fully. However, we know its role in regulating functions and processes, which include sleep, mood, appetite, memory, reproduction, and fertility. The ECS consists of three primary components: the endocannabinoids, receptors, and enzymes. Endocannabinoids, called endogenous cannabinoids, are molecules created in your body. They are very similar to cannabinoids, however, your body produces them. We've identified two key endocannabinoids so far: AEA and 2-AG. And yes, the ECS is active in your body. No, cannabis does not need to be present in your body for the ECS to be activated.
As stated before, endocannabinoids are essential chemical compounds in the human body. When interacting with cannabinoid receptors like CB1 and CB2, they can influence body functions and offer therapeutic benefits for conditions like chronic pain, inflammation, and appetite. Again, they play a significant role in maintaining internal balance, homeostasis. When cannabinoid receptors are stimulated, a variation of physiologic processes result. As mentioned above, researchers have identified two primary cannabinoid receptors: CB1, which is predominantly present in the nervous system, connective tissues, glands, and organs, and CB2, which is primarily found in the nervous system and its respective structures. CB1 receptors are generally located in the brain and central nervous system. They regulate functions like brain cognition, memory, motor movements, and pain perception. CB1 receptors are very active in regions of the brain that manage emotions and cognitive functions. Outside the brain, these receptors can also be found in the liver, thyroid, bones, and testicular tissue, signifying an extensive role in the human body. We all know about cannabis and the potential for an increased appetite, which we call the munchies. But what is fascinating is that a study by Randy and Lori Sampson showed that CB1 receptor antagonists could be used potentially for treatments like obesity. Research is still being done, but you could potentially manipulate appetite and body weight, which has shown promising therapeutic benefits. This research alone demonstrates how vast and versatile CB1 receptors can impact human life. These receptors can influence not just neural pathways, but also systematic health and management of multiple diseases, not just chronic pain relief and obesity-related issues. CB2 receptors are mainly located in immune tissues. Some examples are the liver, kidneys, white blood cells, and the GI tract. It all plays a crucial role in the human body. CB2 receptors are essential when controlling gut issues like inflammatory bowel disease. Beyond their role in the immune system, CB2 receptors are significant in the central nervous system, contributing to brain functions. Regarding human production, CB2 receptors are very much involved in the reproductive biology for both males and females, signifying their medical potential to address infertility issues. CB2 receptors serve a critical role in governing functions from digestion to reproduction. It is an intriguing facet of how our bodies can maintain health and stability. In the endocannabinoid system, in addition to the more popular CB1 and CB2 receptors, there are additional cannabinoid receptors that play a significant role. These are a bit too detailed for this training, but they include a variety of G protein coupled receptors, ion channels, and nuclear receptors. These provide a complex system further than CB1 and CB2. While CB1 and CB2 predominantly control processes like immune response and neuropathic pain, the other receptors like GPR55 and TRPV1 have distinctive connections with cannabinoids. The potential to find undiscovered cannabinoid receptors informs us that there may be a more intricate system at play, more than we can presently comprehend, which points to an innovative opportunities for us to understand how the endocannabinoid system influences body functions and addresses various human diseases.
Here's a picture of various cannabinoid receptors that play a role in the endocannabinoid system. We're not really going to discuss this slide, but you can refer to it when you need, and you can review the different receptors and their capabilities. Again, this is fascinating to know so many therapeutic possibilities cannabis can provide in the human body.
This picture demonstrates where CB1 and CB2 receptors can be found in the human body. It's really a whole body experience. The red dots indicate CB1, the green dots indicate CB2. There are two other videos you can click and view at your own. They discuss CB1 and CB2 receptors. THC and CBD. Tetrahydrocannabidiol, THC, is a psychoactive substance found in a cannabis plant, and it produces the high effect. CBD, cannabidiol, does not produce the psychoactive or the high effect. CBD and THC are two of the multiple cannabinoids that are present in the cannabis plant. Yes, they have very similar structures, but they interact with different receptors. Cannabidiol and delta-9, THC, are the most researched. However, we have identified more than 113 reliable sources of other cannabinoids that can also influence the human body. The cannabis plant offers a wide range of components from medical cannabis and targeting cannabinoid receptors in the human body. These formulations have a vast amount of compounds like THC and CBD that can provide therapeutic benefits for various health conditions. Potential uses of these CBD, THC, and other cannabinoids can include treating pain, nausea, cancer, appetite loss, eating disorders, epilepsy, spinal cord injury, glaucoma, multiple sclerosis or MS, Tourette's, anxiety, PTSD, post-traumatic stress disorder, irritable bowel syndrome, and sleep problems. Although CBD, THC, and other cannabinoid receptors can interact with the endocannabinoid system inside all our bodies. Do you know the difference between cannabis strains? In the world of cannabis plants, the most popular are indica, sativa, and hybrid. They each have unique properties and therapeutic medicinal benefits. Indica strains, which are very popular, are known for their relaxing sensations, ideal for a relaxed environment and can be used as a sleeping aid. Sativa strains lean more towards being energizing and focused. They can also provide a boost in mood and increase creativity. This strain is ideal for needing a creative jumpstart, social or possible outdoor activities, or to focus on a task at hand. Hybrid strands, yes, you can imagine, are a blend of some fashion of indica and sativa strands. Some hybrid strands lean more towards one or the other, and some are 50-50. Hybrids can be more indica or sativa dominant, but either way, the goal is to provide a combination of relaxation and stimulation, depending on the strand's properties and lineage. You may realize now that most strands are hybrids. Within the indica, sativa, and hybrids, you have specific strands with detailed properties used to treat different illnesses and ailments. Strands like Blue Dream, Runts, Ether, and Wedding Cake demonstrate how there is such a wide variety of strands accessible. They provide several effects, like happiness, but can also deliver a euphoric feeling, a sense of relaxation, or a boost of energy. Understanding your body and experimenting with different strands can help you tailor your dosage to meet your needs. You can determine how to properly treat any ailment or illness utilizing the incredible therapeutic benefits of cannabis. This slide shows what is Delta 8, where does it come from, and how it's made. The psychoactive substance that can be found in the cannabis plant is called Delta 8 tetrahydrocannabidiol, also known as Delta 8 THC. Like Delta 9 THC, it has intoxicating effects. However, it isn't as strong and it is synthetic. It comes from the hemp plant, and because it comes from the hemp plant, it is available to purchase in stores and other retail environments. Delta 8 is one of over 113 cannabinoids produced naturally by the cannabis plant. However, there are only small amounts located in the cannabis plant. The concentrated amounts are manufactured typically from hemp derivative CBD. Delta 8 is known as a synthetic cannabis and is considered unsafe for human consumption by the FDA. Most concerns center around the lack of regulation, which poses safety, purity, and dose strength concerns. Since only small amounts of Delta 8 are found, additional chemicals convert different cannabinoids from hemp. It could contain harmful contaminants, and since it is synthetic cannabinoid, some concerns also deal with the harmful synthetic process, which includes byproducts and chemicals to change the color itself, all of which could cause serious harm to the body if inhaled or consumed. Other issues centered around product labeling, which can be misleading, false claims of healing properties, and very toxic to children and pets. Consumers must understand and be careful about consuming Delta 8 products. None of these products have been evaluated or approved by the FDA. Be aware of sneaky marketing techniques which can mislead the public as well. This picture indicates different health properties and therapeutic effects that CBD can provide. The blood vessels, the heart, liver, kidney, and brain. CBD, cannabidiol, is a chemical located in the cannabis sativa plant. Some refer to it as hemp. CBD does not have psychoactive properties like THC. In 2018, the Farm Bill allowed the sale of hemp and hemp products that were legal in the U.S. For CBD to remain legal, it must have below 0.03% of THC. We have found a prescription form of CBD. It is used to treat seizure disorders like epilepsy. It is called Epidiolex. CBD can also treat other muscle disorders and anxiety and pain and other conditions. Further research is still needed to determine its full capabilities. Edibles have become popular among states where cannabis is legal for recreational and medicinal purposes. For example, in Colorado, 1.96 million units of edible medicinal cannabis infused products and 2.85 million units of edible retail cannabis infused products were sold, which accounted for about 45% of the total cannabis sales in the state. Edibles come in many variations of food products that can be infused with cannabis. They come in various forms, each offering unique characteristics to satisfy one's interests. Baked goods. The most well-known form including brownies, treats, cookies, and cakes. They are popular for their familiar form and ease of consumption. Many people decide on this form of usage because of its ability to be infused privately. Candies and gummies. These are small, discreet, and in various flavors. They offer a controlled dosage per piece, which is helpful for a consistent dosing. Chocolates. These are another popular option. Chocolates mask the cannabis flavor well and is available in multiple concentrations and flavors. Beverages, including teas, sodas, juices, and even alcoholic mixers. They offer an alternative for those who prefer to drink their cannabis. Tinctures. These are liquid extracts that can be taken under the tongue or added to food. They offer precise dosing and faster onset of effects compared to other edibles. Capsules. Similar to traditional medicine, these are filled with cannabis oil. They provide a discreet, dose-controlled, and non-caloric way to consume cannabis. Cooking oils and butter. Cannabis-infused oils and butter can be used in home cooking, allowing for a wide range of homemade edibles. Provided as a single serving size, it helps a consumer determine how much they need to ingest. For each edible form has a different onset time and duration of effect, primarily due to how they are processed in the body. It is essential to start with a low dose and go slow, especially for beginners, as the effects of edibles can be potent and longer lasting compared to other forms of cannabis consumption. Consuming this form of cannabis has a delayed peak in which it takes effect. Many can feel the effects, and it could take up to 30 minutes or to an hour and a half, and can last up to a few hours depending on how much the THC is ingested. Cannabis edible products infused with cannabinoids for oil consumption offer an alternative route of administration to smoking or vaporizing cannabis. These edibles typically contain the active components THC tetrahydrocannabidiol or CBD cannabidiol, along with other cannabinoids. Unlike smoking or vaping, which deliver cannabinoids directly to the bloodstream through the lungs, edibles introduce these compounds through the gastrointestinal tract. This method of consumption begins with ingestion, followed by digestion and absorption in the stomach and intestines before the cannabinoids reach the liver, where they are metabolized. The metabolized compounds then enter the bloodstream. This process results in a delayed onset of effects, often taking 30 minutes to 2 hours, but the effects can be more intense and longer lasting than smoking. Tinctures can be taken sublingually or by mouth, in which drops are placed under the tongue and absorbed via the blood vessels on the mucous membrane, and still some end up in the digestive system. Another method orally is ingesting medical cannabis through capsules. The form of cannabis edibles varies widely, including baked goods, beverages, and even savory snacks shown on the previous slide. This diversity in form factor caters to different preferences and may impact the onset of duration of effects. For instance, liquid edibles like beverages may be absorbed more quickly than dense fatty baked goods. The composition of the edible, specifically the presence of fats, can enhance the solubility of cannabinoids, potentially affecting their absorption rate and potency. The diversity in edible forms also allows for easier dose control, which is particularly important given the delayed onset of effects and the variability in individual responses to cannabis, even though the delivery methods have a wide range of products to ingest. The pharmacology of edibles are distinct from other routes of cannabis administration. Once ingested, the THC in cannabis is converted by the liver into 11-hydroxy-THC, a potent psychoactive compound that contributes to the intensified and prolonged effects often reported with edibles. This conversion and the slower absorption process through the digestive system results in a different experience than inhalation, where the effects are felt almost immediately and tend to diminish more rapidly. Users of edibles should be aware of these differences, particularly the delayed onset and prolonged duration, to avoid overconsumption and undesirable effects. This highlights the importance of the start low, go slow approach, especially for inexperienced users or those trying a new edible product. This chart shows general dosing guidelines, from your beginner to your more experienced and to your advanced user. Navigating dosing with cannabis can be challenging due to the delayed onset and prolonged duration of effects compared to other forms of consumption. Generally, edibles are measured in milligrams of THC, the main psychoactive component in cannabis. For beginners or those with a low tolerance, it is advisable to start with a low dose, typically between 1 and 2.5 milligrams of THC. This conservative approach helps users gauge their response to the edible's effects, which can vary widely depending on factors like body weight, metabolism, and individual sensitivity to THC. It is essential to understand the same dose may affect individuals differently, and what might be a mild dose for one person could be overwhelming for another. Gradually increasing the dose is critical in finding the optimal amount that provides the desired effects without discomfort. Once familiar with the initial effects, users might increase the dose in small increments, such as 2.5 to 15 milligrams, waiting at least 24 hours before trying a higher dose. This cautious approach is essential due to the extended duration of effects from edibles, which can last anywhere from 4 to 12 hours, sometimes even longer. The start low and go slow mantra is critical to avoid overconsumption, which can lead to unpleasant experiences such as anxiety, paranoia, or physical discomfort. For regular cannabis users with a higher tolerance, the dosing can begin at a slightly higher range, such as 10, 15, or 30 milligrams of THC. Even experienced users should be cautious, as the side effects of edibles can be significantly different and more intense than smoking or vaping. It is also essential to consider the context in which the edible is consumed, as factors like an empty stomach can amplify the effects. When consuming edibles in a social setting or for a specific purpose like pain management or sleep aid, it is wise to stick to a known, comfortable dose and be mindful of the setting and current state of well being. As always, consume in a safe environment. Labeling and regulation of cannabis edibles can vary significantly by region, making it crucial for users to carefully read product labels and understand the THC content per serving. In areas where cannabis is legally regulated, products usually have a clear labeling showing the total amount of THC in the entire product and per serving. However, this information might only be as accurate in areas with such regulation, necessitating even greater caution. Consumers should also be aware of the presence of CBD in edibles, which can modulate the effects of THC, often mitigating some of their psychoactive impacts. Understanding the ratio of THC to CBD in an edible can further guide users in selecting a product that aligns with their desired experience.
Pharmacology is the scientific study of the effects of drugs and chemicals on living organisms. Edible consumption of cannabis, particularly those that are ingested orally, follows a distinct pharmacological process encompassing absorption, distribution, metabolism, and elimination. Absorption. When a drug is consumed orally, it first enters the digestive system. Here it is absorbed through the lining of the stomach, or more commonly the intestines. The rate and extent of the absorption depend on factors like the drug's formation, the presence of food in the stomach, and the pH of the GI tract. Lipid soluble, which means loving fat, drugs tend to be absorbed more rapidly. This process determines how quickly and how much of the drug reaches the bloodstream. Since many people respond differently to taking the same type of ingestion, two factors play an essential role when understanding how they will be affected. Bioavailability and inter-individual variability depend on the individual. Bioavailability measures the amount of cannabis that is ingested orally with a high fat content, which generally can result in an increased bioavailability when you eat on an empty stomach than when you have eaten already. Distribution. Once absorbed, the drug enters the bloodstream and is distributed throughout the body. The distribution is influenced by the blood flow to various organs. The permeability of cell membrane to the drug and the drug's affinity for different tissues. Some drugs may bind to plasma proteins which affect their distribution. Only unbound or free drugs can exert a pharmacological effect. Lipid soluble, which is fat loving, drugs can cross the blood-stream barrier and other membrane barriers more easily than water soluble drugs, making it easier for them to absorb. Metabolism. Metabolism, primarily occurring in the liver, transforms the drug into more water-soluble compounds, facilitating elimination. This process often involves enzymes such as cytochrome P450. Metabolisms can lead to drug inactivation, but in some cases, it can convert to a prodrug or an inactive substance into an active form. Genetic factors, age, diet, and other medications can influence drug metabolism, potentially leading to variations in the drug effects among different individuals. The diagram shows that when an edible is ingested, the product travels to the stomach, then to the liver, and then goes through the first pass metabolism. The remaining THC enters the bloodstream and is absorbed into your vascular tissue. Note, smoking bypasses first pass metabolism, meaning it goes straight into the lungs. Elimination. The final phase is eliminating the drug and its metabolites from the body, primarily through the kidneys. Rectal excretion involves filtration and secretion and then reabsorption. Factors like urinary pH and flow rate can influence the rate of drug elimination. Some drugs are also excreted through the bile into the feces or through the lungs in the case of volatile substances. When discussing pharmacokinetics and the extent of edibles, such as those containing cannabinoids or other active ingredients, pharmacokinetics can be significantly different from other forms of administration. The onset of action is usually slower and the effect duration is longer than inhalation or IV intravenous administration. This is due to the slower and more variable absorption in the GI tract. The liver's first pass metabolism also plays a crucial role, often leading to the production of different metabolites compared to other routes of administration. Overconsumption of edibles. Overconsumption of cannabis edibles poses several potential health risks due to their unique pharmacokinetic properties. These risks can be more pronounced compared to other methods of cannabis administration, such as smoking or vaping. Delayed onset or prolonged effects. One of the most significant risks of cannabis edibles is the delayed onset of effects. Unlike smoking or vaping, where the effects are almost immediate, edibles can take anywhere from 30 minutes to several hours for effects to manifest. This delay is due to the need for the edible to pass through the digestive system and be metabolized by the liver before entering the bloodstream. Because of this delay, individuals may consume more thinking they have not taken enough, leading to overconsumption. Again, start low, go slow. Unpredictable potency and dosage issues. The potency of cannabis edibles can be highly variable, and accurately determining the dose can be challenging. This variability can lead to unintentional overconsumption. Homemade edibles are particularly prone to this issue as the distribution of THC can be uneven. Even with commercially produced edibles where dosing should be more consistent, there can still be variations. Without clear and consistent labeling and dosing information, users may ingest more THC than intended. Intense psychoactive and physical effects of overconsumption of cannabis edibles can lead to an intense and sometimes distressed psychoactive effects. These may include severe anxiety, panic attacks, paranoia, and hallucinations. Physically, users might experience increased heart rate, nausea, vomiting, and impaired motor skills. Such effects cause immediate discomfort and pose risk, particularly if the person attempts to drive or operate machinery. While a psychotic reaction can occur following any method of use, emergency room responders have even seen an increased number of cases involving cannabis edibles. Some people, especially teens and preteens, who know very little about edibles, do not realize that it takes longer for the body to feel the cannabis effects when ingested rather than smoked. Some of the long-term risks, while researching is still ongoing, there are concerns about the long-term health effects of chronic cannabis use, particularly with high doses. Potential risks include impaired cognitive function and decreased motivation, and the possible exacerbation of underlying mental health issues like depression or psychosis. Additionally, while cannabis is often seen as less addictive than other substances, there is still a risk of developing a dependency, especially with regular overconsumption. Taking breaks or microdosing will help this. Overall, the key to safe consumption of cannabis edibles lies in understanding that their delayed and prolonged effects, starting with a low dose and waiting for effects to manifest before consuming more.
Cannabis intoxication, particularly from overconsumption of edibles, can be an uncomfortable experience. CBD can counteract THC intoxication, however, it may not always be available and takes time. While most symptoms are self-limiting and tend to resolve independently, several strategies and options can be employed to manage and alleviate these symptoms. The first and foremost crucial step is to remain calm. Cannabis intoxication, although potentially distressing, is not life-threatening. Moving to a quiet, safe, and comfortable environment can help reduce anxiety and stress. This is particularly important as cannabis can heighten sensory perceptions, making bright lights and loud noises overwhelming. A calm setting can provide security and reduce the risk of accidents or injuries. Staying calm, staying hydrated is essential. Drinking water or clear fluids can help prevent dehydration, especially if the person is experiencing symptoms like dry mouth, nausea, or vomiting. However, it is advisable to avoid alcohol and caffeine as they can exacerbate dehydration and anxiety. Eating light snacks can also help, especially if the person feels lightheaded or weak. Foods that are easy on the stomach, like crackers or toast, can be beneficial. It is crucial to avoid consuming more cannabis. This includes not only edibles, but also smoking and vaping, as THC can worsen the symptoms of intoxication. It is also essential to keep the individual from using other substances, as combining drugs can lead to unpredictable and potentially dangerous effects. For symptoms like anxiety and pain, deep breathing exercises, relaxation techniques, or distractions like listening to soothing music or watching a familiar, comforting TV show can help. If the person is experiencing nausea, laying down and avoiding sudden movements can be helpful. Over-the-counter remedies can be considered, but it is advisable to consult a healthcare professional before taking any medication. In cases where symptoms are severe, such as extreme paranoia, hallucinations, or if there's any concern about the individual's safety, seeking medical attention is essential. Healthcare professionals can provide supportive care and monitor vital signs. In a medical setting, interventions to address symptoms like anti-anxiety medication can be administered safely. Managing cannabis intoxication involves creating a safe and comfortable environment, staying hydrated, avoiding further cannabis use, employing symptomatic treatments, and seeking medical help if necessary. Most cases are resolved with time and supportive care. Cannabis, particularly its active compounds like THC and CBD, can interact with a range of medications, potentially altering their effects. Understanding these interactions is vital for anyone using cannabis, either medicinally or recreationally, alongside other medications. One of the primary concerns with cannabis use is its effect on the cytochrome P450 enzyme system in the liver. This is responsible for metabolizing many drugs. Compounds in cannabis can inhibit or induce these enzymes, leading to a slower or faster metabolism of other medications. For example, CBD is a known inhibitor of certain P450 enzymes. This can lead to higher levels of co-administered drugs in the bloodstream, potentially increasing their effects and the risk of side effects. Conversely, induction can lead to reduced drug levels, decreasing the efficacy. Cannabis can enhance the sedative effects of drugs that depress the central nervous system, such as opioids, benzodiazepines, antihistamines, and some other antidepressants. This can lead to an increased drowsiness, cognitive impairment, and decreased motor coordination. In some severe cases, this could result in a dangerously slow breathing, particularly with opioids. Users should be cautious about engaging in activities that require alertness, such as driving. THC and the effect of blood pressure in some individuals can also cause problems, especially with the heart. This effect can be problematic for those taking medications for hypertension or other heart conditions, as it may counteract their effects. Conversely, in some cases, it might lead to an addictive hypotensive effect when used with blood pressure lowering medications, potentially resulting in symptoms like dizziness or fainting. Cannabis can also interact with psychiatric drugs, including antidepressants and antipsychotics, and mood stabilizers. These interactions can be complex and unpredictable, potentially affecting the efficacy of the psychiatric medicines or exacerbating mental health symptoms. For instance, THC can increase anxiety and paranoia in some individuals, which could be detrimental to those with anxiety disorders or schizophrenia. Given these potential interactions, it is crucial for individuals using cannabis and other medications to consult with healthcare professionals. This ensures appropriate monitoring and adjustments of medication regimens to manage their conditions safely.
The legal ramifications of cannabis are multifaceted and extend across various domains of society, reflecting the complexity of integrating a substance that has been illegal for decades into a legal framework. In the criminal justice system, the most immediate impact of legalizing cannabis would be a significant reduction in arrests and incarcerations for cannabis-related offenses. This shift could alleviate the burden on the legal and penal system and redirect resources to more serious crimes. However, it also raises questions about the status of individuals previously convicted of cannabis-related offenses. There is a growing call for these convictions to be expunged or reduced, recognizing the disproportionate impact of cannabis laws on specific communities. Nonetheless, this process involves complex legal bureaucratic challenges requiring clear policies and resources to ensure fair and efficient implementation. On the regulatory front, legalizing cannabis necessitates the establishment of comprehensive frameworks to govern its production, distribution, and sale. This involves setting quality and safety standards, licensing procedures in retailers, and implementing measures to prevent underage use and diversion to the illicit market. The challenge lies in balancing sufficiently regulating the industry to ensure public safety and avoiding overly stringent restrictions that could sustain the black market. Furthermore, discrepancies between state and federal laws, particularly if cannabis remains legal at the federal level, complicate regulation and enforcement, affecting everything from banking services for cannabis businesses to the enforcement of contracts in the industry. Economically, cannabis legalization opens up significant market opportunities, potentially leading to job creation, business growth, and considerable tax revenue. However, it also poses challenges in terms of market regulation, such as preventing monopolies, some vertical integration, ensuring fair competition, and managing economic impact on communities previously affected by cannabis prohibition. Additionally, there are concerns about the market and commercialization of cannabis, particularly regarding the promotion of high potency products and the potential targeting of vulnerable populations, including youth. Lastly, in the realm of employment and civil rights, legalizing cannabis raises questions about drug testing policies, workplace safety, and discrimination. Employers must navigate the complexities of maintaining a safe and productive workplace while respecting the legal rights of employees who use cannabis, particularly for medical purposes. This involves reevaluating drug testing policies and balancing them against employees' rights to privacy and medical treatment. Moreover, as cannabis use becomes more socially accepted, there may be a need for legal protections against discrimination for lawful, off-duty cannabis use. In conclusion, the potential legal ramifications of legalizing cannabis are extensive and complex, touching on criminal justice, regulatory frameworks, economic policies, and civil rights. Navigating these challenges requires careful, informed policymaking decisions, considering the diverse and sometimes competing interests in integrating cannabis into the legal and social institutions. As of February 2024, the legal status of cannabis in the United States presents a complex and often contradictory landscape due to the differing federal and state laws. Federally, cannabis remains classified as a Schedule I substance under the Controlled Substances Act. This classification indicates that cannabis is considered to have a high potential for abuse, no currently accepted medical use and treatment in the United States, and a lack of accepted safety for use under medical supervision. Consequently, at the federal level, the production, distribution, and possession of cannabis are illegal, and federal law enforcement agencies and courts can prosecute these activities. However, the landscape at the state level is marked differently and continuously evolving. Many states have taken steps to decriminalize or legalize cannabis for either medical or recreational use or both. As of the last known data, over 30 states, along with Washington, D.C., have legalized cannabis for medical use, allowing patients with qualifying conditions to possess the use of cannabis with doctor's recommendation. Beyond medical use, a growing number of states have also legalized cannabis for recreational use by adults, which permits the commercial sale of cannabis and allows adults to possess and use it within certain limits. These state laws directly conflict with federal law, creating a complex legal environment where activities may be legal at the state level but still illegal federally. The federal government, particularly under recent administrations, have generally taken a hands-off approach to enforcing cannabis prohibition in states that have chosen to legalize it, either for medically or recreational use. Guidance like the Cole Memo, issued during the Obama administration, directed federal prosecutors to focus on significant traffickers and operators, but not individuals and businesses compliant with state laws. Although this guidance does not have a force of law, it was rescinded under the Trump administration. The general approach has been non-interference in states with legal cannabis markets. However, this does not remove the risk of federal action, as the discrepancy between state and federal law still exists. This inconsistency between state and federal law creates various challenges and uncertainties. For instance, businesses operating legally under state law are often unable to access banking services, as banks, which are federally regulated, may fear repercussions for servicing the cannabis industry. Similarly, individuals who use cannabis legally under their state's law may still face consequences under federal law affecting employment, housing, and more. Moreover, the patchwork of the state law creates a landscape where the legal status of cannabis activities may vary significantly from one state to another, complicating enforcement and creating confusion for consumers, businesses, and law enforcement agencies. The call for federal reform, whether rescheduling or descheduling or some form of federal legalization, reflects reflects the growing recognition of these complexities and their challenges.
Medical cannabis is legal in Florida. To be qualified, a patient must be a seasonal or permanent resident in Florida, have been diagnosed by a qualified physician with a medical condition that is ruled eligible for medical cannabis. Patient must be registered in the Medical Cannabis Use Registry and receive a Medical Cannabis Use Registry identification card. The link below provides more information on obtaining your medical cannabis card in Florida. To obtain a medical cannabis card, please refer to your state's guidelines. These may differ in some states, so be sure to review each requirement. This slide provides a summary of the previous modules. The endocannabinoid system's job is always to put the body back into homeostasis. CBD, non-psychoactive, and THC is psychoactive, and they are two of the many cannabinoids found in the cannabis plant. Edibles come in many forms: baked goods, candies, beverages, tinctures, cooking oils, and butter. When trying edibles for the first time, it's always good to start with a low dosage and go slow. Wait, be patient, and see how your body responds. Edible consumption of the cannabis, particularly those that are ingested orally, follows a distinct pharmacological process encompassing absorption, distribution, metabolism, and elimination. If you overconsume and had adverse reactions to cannabis, stay calm, grab something to eat, drink water, and if needed, seek medical attention.
Cannabis does interact with some medications, which could cause some uncomfortable adverse reactions. Please be responsible. Cannabis is still illegal at the federal level and listed under the Schedule 1 substance under the CSA. Please ensure you adhere to your state's guidelines and regulations. If caught, jail time is not likely, however, the legal ramifications could be exhaustive. Check with your state to determine steps to obtain a medical cannabis card. Again, this link is for Florida patients.
These links provided are additional information that could be useful to expand your knowledge on edible consumption and cannabis in general in the current state in the US. There are a few videos on CB1 and CB2 receptors, some studies that were completed on cannabis consumption, a dosage chart, some federal government links to different documents and websites in regards to cannabis and its current federal status. This information is constantly changing, so it is advised to only use reliable and credible sources.
This concludes your training on edible consumption. We truly hope you found these modules informational and stimulating. Please take a few minutes to complete the survey for us so we can continue providing the most effective training and determine any adjustments that may be required. Please reach out to us or your HR department or supervisor for additional questions and comments. Thank you for your time.